Hi there. My name is Nishal Lal, and the nursing quality and safety advocacy topic that I selected is patient falls. The reason why I chose patient falls is because this is a very important issue in nursing and as well as patient safety. As we get further into the PowerPoint, I'll talk more in depth about the different statistics of how many patients fall and the interventions that nurses can take as well. Getting it. So why is preventing falls important? Anything that has to do with patient care is the forefront of nursing and healthcare overall. Making sure our patients are safe, making sure that the proper interventions are taken to prevent patients from falling is very important because falling can result in serious injuries and even death. Patient falls is also something that is preventable as well with the use of education, proper tools such as fall risk assessment tools, and different interventions. Falls can be prevented, and that leads to overall better outcome for the patient and the liability of either the nurse being negligible in patient prevention strategies or the hospital or healthcare facility not having the resources needed or the information ready for the patients or the nurses to be able to do their job as well. Patient falls is something that I see every day. Unfortunately, in the hospital, working in the ER, there are patients who have falls, and we have interventions and tools in place to help prevent that. But it does still occur sometimes. And I've seen firsthand how patient falls play a serious and very life-altering experience for patients as far as recovery and the injuries that they sustain from that. Statistics. So as you can see from this chart here, about roughly 700,000 to 1 million patient falls occur per year in the United States. That is a very large and staggering number. As you can see from the chart, the trend is definitely going up in terms of falls that result in death. It looks like seven fall deaths every hour by 2030. This is due to the sheer population, the number of patients who are in the hospital, and as well as not of nurses and healthcare facilities not doing enough when it comes to intervention of patients falling and risking or screening patients who are high fall risks as well. Continuing, there is used a pie chart here, pretty much explaining where falls most occur in the hospital or facility setting. Just to highlight a couple very important aspects of this pie chart, there are a lot of falls that happen when the patient is trying to use the bathroom, ambulating to the bathroom. It looks like from here, patient fell in the bathroom unassisted accounts for 16%. Patient fell in the bathroom 11%. Patient fell walking to the bathroom 10%. So a large portion of falls occur when the patient is trying to ambulate to use the restroom. That's not limited to just the bathroom, but this is one area which should be highlighted because of the frequency of falls that occur when the patient is trying to do this. From the CDC fall prevention statistics, every 20 minutes an older adult dies from a fall in the United States, and many more are injured. So just looking at the numbers and the statistics overall, we can see that there is a very large population of older patients in the hospital, And from that large population, there is also patients who fall and risk hurting themselves or dying from the fall very frequently. So that's why this is a very important issue in nursing and patient safety, because of the sheer number of patients and the very significant injuries that can occur from these falls. It's important to make sure that nurses, hospitals, and healthcare staff are aware of the complications and aware of the interventions that they have at their disposal to help prevent falls. And that is something that we will talk more in depth about later in the slide. Why do patients fall? There's not just one reason which patients might fall. There's a lot of different reasons. For example, cognitive impairment, environmental hazards, physiological abnormalities, patient impairment, lower extremity weakness too. So just talking a little bit more in depth about that. Cognitive impairment, is the patient a dementia patient? Do they have Alzheimer's? Are they confused about where they are at and then they're trying to get out of bed to leave? So these are all important aspects that the nurse must consider when doing a patient's fall risk screening, in order to placing the right interventions in order to help reducing the risk of falls. Environmental hazards, making sure that the room is decluttered, there's not bags or anything the patient can trip on in the room. Physiological abnormalities such as hypotensive or positional hypotension, where the patient sits up from bed too quickly and stands up and becomes dizzy and has a syncopal episode, which is the reason why they had that fall. From mobility impairments, patients using cane or a walker, and lower extremity weakness, patient was able to ambulate about 10 feet and then their legs became very weak and then they had the fall, even though they were using their correct mobility assistance tool. That is also another possibility. So it's definitely very important to be able to identify the type of risk that a patient may have before their fall, and getting ahead of that and making sure the right interventions are in place. This is talking about the impact of falls on patients. These are just a few potential impacts that a fall may result in a patient. As we know, older patients have many different heart conditions. A very common one is atrial fibrillation, where the patient is placed on a blood thinner like Eliquis or Plavix or warfarin. So that makes them very susceptible to having brain hemorrhages or internal bleeding whenever they have a fall. So that is something that is very important for the nurse and healthcare staff to be aware of, and also at post-fall, assessing the patient and revising a new plan in order to care for the patient. Another common and frequent injury is broken or fractured bones, and this can lead to different lifestyle changes as well, from the patient being ambulatory to the patient, for example, falling and breaking their femur, having to go to long-term rehab care, and then having to use a cane or a walker post-fall in order to prevent a fall. And another area I wanted to highlight was the patient's confidence, because it's also very important to note that once a patient falls, they may be more hesitant to walk, or maybe they are more scared of falling again. So that is also an impact of a patient fall that's not physical, but more on the mental side. To prevent falls, patient care is the forefront of our nursing goal and Patient safety is the responsibility of everyone who is involved in the patient care, not just the nurse or the doctor, but patient safety and patient care. Patient safety is not just regulated to one person. It takes a team. For example, like for me working in the hospital, the nurse, everyone's very busy. There's a lot of patients, so you can see walking down the hall, if you see another patient trying to get out of bed and the nurse is either not there or busy assisting another patient, you have to be able to step in and help that patient before they have a fall. Even though it's not your patient, it's still your responsibility and your responsibility as a nurse to be there to prevent falls and advocate for patient safety. So it's very important to take that time and to help that patient and that nurse from hurting themselves or having a fall. These are different strategies and interventions that we are able to use to prevent falls. Some physical preventions could be bed alarms, restraints, removing clutter from the room, fall mats as well. Sometimes we are able to use chemical restraints when it's medically necessary and ordered by the physician to help calm the patient down and prevent the patient from falling. Another very important intervention we can use is a patient sitter, as we call them in the hospital, or just kind of a patient watcher, someone who is one-on-one with the patient, who is able to monitor the patient 24/7 and be there to assist the patient if they have to ambulate to the bathroom or remind the patient not to get out of bed. So that is a very effective tool, I believe, in preventing patient falls. Another important strategy would be to inform the patient the risk of falls and why we don't want the patient to be walking on their own and the potential complications that may occur from the patient falling and having to deal with injuries afterward. It's very important to also, if applicable, if there is a family member present as well, to teach them about the importance of calling before the patient tries to ambulate on their own, or if the patient is trying to get out of bed. And one important note I want to make is that while we are teaching and educating the patient's family, we are not giving liability or responsibility to ensure the patient does not fall. That falls on the nurse, and it falls on the hospital or facility as well. Making sure that the nurse is able to have the proper training to assess the patient's fall risk and have the proper equipment needed to install those interventions as well. Advocating for staff. This is very important when situations arise where the nurse is, very busy, not able to be there. You have to be able to speak up and be able to advocate for your patient, advocate for yourself, talk to your supervisor or charge nurse, ask them that you need a sitter for this specific patient, or you just need someone else to help this patient use the restroom while you're dealing with another critically ill patient, for example. So it's very important to ask for help when you need it, not only for your liability, but also for the safety of the patient and safety of everyone involved as well. Here we're going to talk about the responsibility and accountability portions of patient falls. So the responsibility on the nurse is to make sure that they conduct accurate and well done fall risk assessments. This includes things like we talked about, cognitive impairment, if the patient is ambulatory at baseline, were the correct fall interventions in place, like bed alarms, or were the railings up, was the fall mat down, was the environment safe before the patient got there, was there anything cluttering the room, In my hospital, something that we do is we place the patient in a yellow gown and also have a yellow wristband and yellow non-slip socks as well. This is just a quick patient identifier to everyone in the hospital and to let the staff know that this patient is a fall risk patient. So they should not be up and walking unassisted. Failure to implement any kind of fall risk or interventions may result in nursing negligence as well. The accountability falls within the nursing range as well as the hospital or whatever healthcare facility the fall occurred in. As far as facilities, they need to be able to provide proper equipment necessary in order to put these fall interventions in place. For example, like bed alarms or fall mats as well. Making sure that the nurses are well trained, knowing their policies and procedures when it comes to preventing falls, and making sure that there are resources available for the nurses. For example, having a sitter when it's needed in order to prevent falls and prevent the patient from hurting themselves. That was done. These are just more of the highlighted points of the case study, but pretty much there was a 60-year-old female patient admitted to the ICU after cardiac arrest. The patient was intubated and in the ICU for about 3 weeks. The patient was then extubated and they were monitoring her cognitive ability, and they ordered physical therapy and occupational therapy to come by and assess the patient. Assessment was done, and the patient was deemed unsteady on her feet and a fall risk by physical therapy. After the evaluation was done, the nurse documented the results and placed the proper and necessary fall risk interventions in the room. The patient was sitting in a recliner chair. A family member was sitting across from the patient, and the nurse told the patient that she would be right back, went to go get supplies in order to change the patient's gown. During the time when the nurse stepped out of the room, the patient stood up, became dizzy, and then fell forward onto her face and onto the floor. The family member called for nursing staff. The staff was able to come and get the patient back into bed. The nurse relayed the information to the neurology team, and they conducted an MRI, which resulted in finding out the patient had some spinal injury, which occurred due to the fall. At that time, the neurology team thought it was best to do surgery, but unfortunately, after the surgery, the patient resulted with paralysis from the neck down, and the patient sued the hospital and the healthcare team who was involved in her care. The outcome for the case was about $1 million settlement with the patient, but it's important to look back and highlight some of the important things that were not done during this case study. For example, the nurse should not have left the patient on her own, even though she needed to go get supplies. The nurse should have asked for another healthcare member, either another nurse, to come in and be with the patient while she left to go get supplies, and that would have helped to prevent this fall, because when she stood up, the other nurse would have been there to help her, or either help her sit back down and tell her to wait for the nurse. So this was a missed opportunity as far as prevention in patient fall, because the right interventions were not in place. And even though the family member was there and was present, it's not their responsibility to make sure the patient does not fall. Those interventions are done by the nurse, and the hospital is also responsible for that as well. So this was a very learning and relevant case study and which is why I included it in this PowerPoint slide as well. To ask any kind of or answer any questions that you may have, and I wanted to highlight that patient falls is a very serious and very concerning issue that is very impactful to patient health and overall quality of life as well. So hopefully after this presentation slide, you are more well able to understand the risks and the interventions necessary in order to help your patient reduce the risk of falling and causing injury to themselves. Okay. And thank you very much.